So my name's Sarah, I'm one of the Junior Research Fellows here at Centre and an Oncology Registrar. And I'm slightly sorry to interrupt that discussion, but I'll just do a final summing up and then we'll have a drink so we can continue the debates. It's been a real pleasure to hear from so many experts here today. And I think we've covered a lot of the really key issues in polygenic risk score and their potential use. We had some fantastic presentations at the start, and thank you to those in the audience who were probably unexpectedly interrogated as part of our discussion afterwards. On the whole, we know the conditions we've been talking about largely today are those that affect huge numbers of the population. So obviously the potential to reduce the incidence of these and improve outcomes is huge, and it's perhaps understandable, therefore, that something like a polygenic risk score, which applies to everybody, has been touted as a potential game changer in healthcare and as affording major opportunities to improve the health of the general population. And that has conferred considerable enthusiasm from industry, from the government, and a huge amount of investment. Today's meeting arose from this desire to find a common ground in what's been at times quite a divisive discourse around polygenic risk scores. And I would observe that it hasn't always been easy to bring the enthusiasts and perhaps voices from industry and the more political side of things to these discussions, and I'm really glad that we had colleagues here from Genomics PLC and Our Future Health, and we very much wanted to hear your voice in these discussions. I think my feeling is from the discussions we've had is that most people here probably fall in the other camp, or part of the spectrum of those who feel that PRS have perhaps been overhyped and don't have the clinical benefits necessarily that was purported at the start, and may even have the potential to do harm if we're not applying them appropriately. If we think about the opportunities, Catherine in her talk highlighted the potential of polygenic risk scores to assist with diagnosis and sort of refining phenotypes of patients with psychiatric disorders. And we've noted in our discussions that perhaps the main use of polygenic risk scores is to identify those who are at very high risk and give them appropriate treatment, as we discussed with the hyperlipidemia. But these represent quite a small number of individuals, and as we've said in several of the presentations, in general, the absolute risk of these diseases, most of the spectrum of the polygenic risk score remains low. And another common theme has, I guess, from these discussions been the potential in the future for use in rarer conditions and perhaps those where our biomarkers don't work so well, and that's maybe where resources like Our Future Health, which is no doubt very valuable, will really help with that. However, I think everyone's noted the limitations of polygenic risk scores both for an individual and population level risk prediction. We've discussed that PRS are innately limited in their predictive ability, partly because of what SNPs are and partly because these are complex diseases and common variation only represents a small part of our risk for those. And all of our speakers have highlighted the limited detection rates afforded by these risk scores, even from an idealised or complete polygenic risk score, and the limited improvement when we're adding them to more common risk factors. And also the significant risk of overdiagnosis when we're applying it to things like prostate cancer. We've noted that other issues at the moment that need to be overcome include the poor reproducibility of the scores, how we communicate and interpret risk scores without potentially causing harm. And we mustn't forget that the results of a polygenic risk score are dependent on the population where they've been studied, and we relatively lightly touched on the importance of thinking about the population that the patient or member of the population comes from, and the limited performance in minority ethnic groups who represent quite a large proportion of the population who are already underserved and are at risk of harm from a poor polygenic risk score. It's notable, I think, that many of our speakers underlined how far they feel we are from implementing this effectively in a clinical setting, although we are clearly already doing that in some parts of the NHS. Jude noted the clear questions about how they would be implemented, where and when, by whom, and the need for effective communication. And I think the context of implementation is really important. We are working in a resource-constrained setting here in the UK and in many other countries, and perhaps we need to reflect on where our priorities lie in terms of what we're implementing. To date, the studies of cost effectiveness in polygenic risk scores in healthcare have been of variable quality, and they haven't always encompassed the whole costing of the whole PRS process, and I look forward to seeing some of the case studies from Genomics PLC. In addition to that, I would add something that hasn't been discussed today, which is that the broader context in which we're making healthcare decisions is rapidly changing. We're in the midst of a climate crisis, and the NHS has committed to net zero healthcare in a relatively short period of time. And mass genetic testing and bioinformatics and data storage required for that is likely to have a significant carbon footprint. And we should also be considering whether we ought to be implementing this in that context. Claire's poll earlier showed that although a minority here felt that polygenic risk scores should be used, we're already using them. And given the political and industry impetus behind them, I think a common ground that we've reached is that they are here, and they're likely to be here in a much broader context in the relatively near future. And in view of that, there's much more, I think, to discuss, and we had hoped that this would form the start of a series of discussions around polygenic risk scores, with all voices heard in the discussion. And we'll be very grateful for your input as to how best to do that over the coming year or so. So if you have any feedback or ideas on what you'd like to see happen next, please do let us know either over a drink or by email after the event. So thank you all for coming. Thank you for fantastic discussions and presentations. And we look forward to continuing this conversation down the line. Thank you.